If that knee pain is something you live with every single day, you probably heard about knee replacement. But what does that really involve? Well, in this explainer, we're going to break it all down for you step by step, based on fantastic guidance from the Mayo Clinic. Let's dive in.
And this really is the main question, isn't it? That constant nagging pain that just stops you from doing the things you really love. It's a heavy weight to carry, for sure. But just understanding what your options are, well, that's the first step to feeling lighter.
So here's our plan. First, we'll talk about the why, the pain itself. Then we'll get into what a knee replacement actually is. After that, how you can get ready for it, what the big day looks like, and finally, the best part, what life is like on the other side. Let's start at the beginning, with the pain.
All right, so first things first. Why would anyone even think about this kind of surgery? You know, it all boils down to one thing: pain. And not just a little ache here and there. We're talking about the kind of pain that starts to run your life.
Do any of these feel familiar? The Mayo Clinic says these are the classic signs. It's when simple things, getting up from a chair, taking the stairs, suddenly they feel like climbing a mountain. That's usually when the conversation about surgery really starts.
So what's actually causing all this trouble? Well, for most people, the culprit is something called osteoarthritis. The simplest way to understand it is to think of it as wear and tear. Imagine the cartilage in your knee is like the tread on a car tire. Over many years, it just wears down. And that's where the grinding, the pain, and all that stiffness comes from.
Okay, so we've talked about the problem. Now, what about the solution? I know, the words knee replacement can sound a little scary, no? But the actual idea behind it is surprisingly simple.
This is a great way to think about it. It's like resurfacing a bad road full of potholes. The surgeon isn't taking out your whole knee, not at all. They are just precisely covering the rough, damaged parts with new, smooth surfaces made of metal and plastic, so the joint can glide smoothly again. Simple as that.
And look, it's not the same for everyone. It's a bit like fixing the tiles in your house, right? If the damage is just in one corner, you might just replace those few tiles. That's like a partial knee replacement. But if the whole floor is in bad shape, you resurface the entire thing, and that's your total knee replacement.
So when you boil it all down, the whole surgery is really just these three main steps. 1. The surgeon removes the damaged stuff. 2. They reshape the bone ends so the new parts will fit perfectly. And 3. They put in the new artificial parts. Remove, reshape, implant. That's the core of it.
All right, let's get practical. How you prepare for the surgery is so important. This is all about setting yourself up for a really smooth recovery. It's about making your home work for you.
And this is where you are in the driver's seat, even before you go to the hospital. Little changes make a huge difference. Things like setting up your bedroom on the ground floor, putting some grab bars in the bathroom. And please, get rid of those loose carpets. These aren't just nice ideas, they are absolutely essential for a safe recovery.
Okay, the big day, the day of the surgery. Knowing what's going to happen can really help with the nerves, so let's just walk through what the procedure's actually like. First question people always ask, how long does it take? And this might surprise you. It's usually just 1 to 2 hours. Think about that. A couple of hours in the operating room could give you 10, 15, even 20 years of a life without that pain. It's a pretty amazing trade-off.
Now, of course, we have to talk about the risks. It's important. With any operation, there's a chance of things like blood clots or an infection, but, and this is a big but, your surgical team has a whole plan to prevent these things. They are completely on top of it, from giving you medicines to keeping everything absolutely sterile. Your safety is their #1 job.
And now for the part everyone really wants to know about. What happens after the surgery? This is where the new chapter starts. The journey to getting back on your feet and enjoying life again.
And listen, your role in recovery starts almost right away. The most important thing? Getting up and moving. Yes, with a walker and with plenty of help, of course, but moving early is your best friend. That, plus some special stockings and maybe some medication, is your #1 defense against any problems.
Okay, the million-dollar question. How long will this new knee last? And the answer is just incredible, actually. We're talking 15 to 20 years for most people these days, sometimes even longer. So you see, this isn't some short-term fix. It's a real long-term investment in your future.
And this is what it's all for, getting your life back. Now, you probably won't be running marathons, but that's okay. A whole new world of activities opens up. A simple walk in the park, going for a swim, a nice round of golf.
A bit of biking. It's about getting back to those simple joys that make life good.
And really, you don't have to take my word for it. This quote from our source, the Mayo Clinic, just says it all perfectly. That's the goal, right? Relief from pain, being able to move better, and just having a better quality of life. It's about so much more than just a joint.
So I'll just leave you with this one thought. Just imagine for a second, a future completely free from that constant knee pain. What would you do? What's the first thing you'd enjoy? What adventures are waiting for you? Because that's the real promise here, a future that's not defined by what you can't do, but by everything you can.